Dr. Krani, it seems very easy to lose weight as such, but have you experienced that patients regain weight back quickly? If so, how do you address that issue?
Once a patient has lost weight, uh, and the things that help patients to lose weight, if they continue the same method, same measures, same attitude in the life, then they can successfully maintain the lost weight. So now let's look at the definition of good weight maintenance. That what is the weight maintenance defined? And there are different institute. So one of the institute talks that if you have lost 5% of your weight, and if you have maintained that 5% lost weight for a year, then it's successful weight loss. Other institute like National Institute of Health, NIH, it considers 10% weight loss, kept it off for a year. And there is another agency, National Weight Control Registry, NWCR. It is the largest prospective study over last 10 years that we have data. In that they consider 30-pound weight loss that you have kept for a year. That's successful. And then you can register online, and there are questions answered, you put it so they can develop a data from that. So for example, now if patient weighs 250 pound and lost 25 pound, means lost about 10%, so it's really successful and kept it up for a year, is good success weight maintenance. But national registry, the person has to have an absolute number 30-pound weight loss for a year. Now it's very difficult to continue the lost weight, absolutely true. The reason is that about at 6 months and after a year, there are definite changes starts happening after you have done medical weight loss. Particularly your ghrelin hormone that causes hunger starts coming back. Your metabolic rate has dropped down significantly once you have lost weight with the diet. Person needing less calorie now than before. And if they don't understand this concept and this change is going to take place, and they're not very careful, then the weight start coming back, and that we call fat attack. And we explain to our patients from the day one that fat attack may start, and we will have a plan for them and make sure that they understand that. And then there is, we call fat attack action plan, and it's like a contract. In that, patient has to sign in the end that they sign in the contract that how they'll keep the weight off. So what happens, suppose it's a test patient, test John. Today's date is January 31st, 2014, and today's weight is 200 pound. He was about 250 to start with, and he has lost 50 pounds. So now current weight is 200 pound. That's his goal, and he wants to maintain that weight. So we have developed a 3-zone, just like asthma action plan. Patients suffering from asthma, we give them action plan so they know exactly what to do when they have breathing difficulty, when their peak flow meter goes down, which medicines to take, when to call doctor, when to go to the emergency room. Exactly similar concept, that they have a pretty good idea of what to do if their weight starts going up. So now what happens, they have a real understanding in their mind that they have to do these things. So now, because current weight is 200 pounds, and as weight changes daily actually, so we have a table here that if your weight is 200, you have up to 4 pounds you can have a room to go up on a daily basis or a weekly basis, but you should not allow it to go more than 204 pounds. So if you are 204 or less, then you are in a green zone, means it's control, and they have to take this action. Main action is continue doing with whatever you're doing. Do not make any changes. And generally, as far as from the data that we have from National Weight Control Registry, we can say that about women requires 1400 calories to maintain that weight. Men require 1600 calories, but again we check their metabolic rate before we put the number on that day, so we know what will be the actually about calories required. We advise to check their weight daily. 1 hour of physical activity will keep your metabolic rate up, It will make your health better. You are conscious, you're doing workout, so you are eating less as well. So it's basically putting all healthy lifestyle into your life. Then about 1 hour of strength activity 2 times a week, because your muscles as we get older are gonna be weaker, and you're gonna lose muscle mass eventually. But if you get good muscle tone and muscle health, it helps you for good postures and your metabolic rate as well. We actually reinforce again the importance of NEAT. NEAT. The NEAT stands for non-exercise activity thermogenesis. Means that activity you do during the daily activity which is not exercise are a very significant role in your weight management. We advise them to park the car far away, not use elevator, not to use escalator, try to lift themselves the baggage other than having some porter do it, anything. As much as work is possible, uh, when they are in the, suppose I'm a doctor, I try to stand in the exam room, try to walk as well more. So that's the way we can increase, and if we do consciously increase in our NEAT, it helps us. We can use pedometer as well, so we can guide them that okay, use at least 10,000 steps, so now they know how much they walked today. Other scientific evidence have shown that for the maintenance that weight that you have lost, one meal replacement plays a major role. And we use Medifast, is that Medifast company, and that was also used in John Hopkins Weight Management Center when their studies were done about that. Importance of any meal replacement is that you have a control calorie, you're aware what you're doing, you're conscious, you are trying to lead healthy life. So when you eat either in the evening or morning, other dinner or lunch, you are very conscious and eat less calories. It's again about bringing awareness. And when you do all these things, you are consciously aware, and that really plays a major role. We also have a flax belt, which is FDA cleared for toning, strengthening abdominal muscles. It's like a medical grade technology. The most problem that we face is abdominal area, central area. We don't pay attention to it. It's very hard to do exercise for those area because it's very painful. We don't have time. Now if you use this for half an hour a day, you are conscious again at that time that I am doing something for it. You just have to tie it and use it. And you don't have to do, you get 150 belly crunches effect. It increases the metabolic rate in that area. You can see by some thermal photography, that blood flows very nicely in those areas. You have a good circulation, tone increases, it strengthens your belly muscles. Again, it gives you awareness that you're doing something. So you, other part of the daily life, you won't eat bad food, because now you have put for half an hour, you consciously putting your awareness in that area, it helps you. Your posture improves, core muscles are the very key part. We have a box called Secret to stay positive, and we suggest that they use that regularly. This is the box Secret that helps. There is a CD, and there is boxes of 3 mantras they have to tell every day, and there is a CD inside which actually helps to change your subconscious mind. It controls your emotions. It helps you to forgive people and live in alignment with everybody, in harmony. When you live in harmony with everyone, with everything around you, you are going to be positive, you're going to be happy. And as soon as you become happy and having gratitude what you have, you're going to have very positive results. And these are the positive cards that helps people. They have to change every day, and they read that, and that gives positive thought right away, because your thoughts are your company. 24/7 you are thinking, and your company is your thoughts. So if you have one thought positive, it can change your life completely in different directions compared to negative thoughts. So again, is based on the philosophy and the concept that our mind, our awareness is the key part in our success with anything. So that's the way the Secret Box helps people remain compliant and positive and committed to their dream. And then 15-minute meditations to stay positive and calm. That's again, we talk about it, how meditation helps you to cleanse your subconscious mind, get you connect to your higher self, your own self. Stop thinking at the time when you are in meditation. When mind does nothing, actually you get everything. The reason that when mind does nothing, you start getting rid of your anger, grief, anxiety, fear, all the negative things start you getting rid of. And getting rid of all things are the most positive thing you can do. We also advise patients to attend one support group meeting at least in 2 to 3 months time. Very important aspect of the weight loss is support. Lot of studies have shown that people who have a professional touch or personal touch with somebody during the weight maintenance is very helpful. So we advise them to attend at least one support group meeting during the maintenance, so they remain positive, they remain in the loop, and they remain positive. Now the other part is yellow zone. That actually, if the weight of that same patient becomes from 205 to 209, then he is in a yellow zone or she is in a yellow zone. And in that case, they have to become more alert, caution. This was control zone, this is a cautious zone. They have to increase physical activity. Instead of 1 meal replacement, they have to do 2 meal replacement. That has shown to lose weight again, because you need to go back to 200 pounds. So now you have to try to lose weight. You need to cut down calories. So meal replacement will make sure that you have cut down your calories back to that level. You will do about 1000 calories. And again, depends on what is metabolic rate. We also suggest at that time to do detox program, and we use Core Restore from the Orthomolecular. It is a 1-week program. It cleans your liver. It makes your metabolic rate to be better, because all the toxins start depositing in the liver, and that slows down the metabolism. So that's very helpful. Again, patient becomes aware that they have to start doing proactive role and positively try to cut down the things. And when you do detox, you can lose about 2 to 5 pounds easily in 1 week. They have to use flax belt more frequently. If they're doing only 3-4 times a week, they can do every day. Sometimes they can do 2 times every day as well. Continue using cigarette more aggressively. Instead of 50 minutes meditations, we would suggest 30 minutes to increase it, and attend 2 support group meetings per month to get back into the rhythm. Is all again about increasing awareness. Decreasing awareness causes the problem, all the problems to come back. Increasing awareness, all to go away. And if the weight goes to 210, he is in the red zone. So now understand this, that patient was 250, and if he had gone all the way down to 200, weight is gonna come back if he's not aware, and that awareness is gonna drop because the way we live the life that way. In that case, now if he doesn't do anything at 210, these patients will come back with 250 pound weight gain back. So it's better to take red actions at 210. It is a red zone, it's a panic, time to panic. Take the action is make an appointment. As soon as you make an appointment, when we address again, patients again just making an appointment, coming here changes his inside totally. We don't do much from outside. His inside has changed now. So he is becoming serious again and sincere. And that awareness is the key part again. And that person can go easily from 210 to 200. It will be easy to do that rather than do from 250 to 200. This is like I give example to patients about the stock market. In stock market, if you bought a stock at $50 and that stock has gone to 90. Now yes, stock market also goes up and down. You want to lock your profit. So now you know this 90, it can go down, it can go up. So what you want to do, you put a stop order, stop loss. So as soon as like it is 90, now you will put an order for sell automatically if it hits 85. So now even if it goes $5, yeah, but then you don't want to lose whatever your profit you made. Correct? So you want to put a stop order in advance. Stop loss order, it means that if it goes below certain price, that order gonna be executed and you are just gonna be fine, because once it start dropping, that stock can go back again lower than what the purchase price was. So it exactly works that way. So you are safe, and this action plan it really gives them very much benefit of having confidence, that now they're confident that okay, because most of the time, as we know, that is very hard to lose weight, but other thing that more people believe strongly, that is hard to maintain the lost weight. And so what happens under that belief, they may start gaining weight back and say, yeah, it's difficult, so it's not good point. So if now they have a plan already, understanding, that will help them a lot. They will have a lot of confidence, faith in themselves, that have patience, that yes, I can do it. And in the back, they would sign that they are, by signing this, I agree to follow the action plan to prevent regaining my lost weight. Now, when you have signed this like that contractual agreement in your mind, you know that I want to live with my words. That's because again, we're trying to work with the ego, the mind. That person will feel bad, guilty. So basically, it's not a legal law or anything, a contract, it's just a moral contract that helps us to keep patients tied with this program, with their commitment and with their dream. And that's all it is about, to keep the lost weight.